Hearing disorders can be placed into two categories: endogenous and exogenous. Endogenous disorders are caused by genetic traits the person inherits from their parents. Some examples of endogenous disorders are Waardenburg syndrome. This syndrome causes a bilateral or both ear hearing loss. It is most recognizable by the non-pigmented piece of hair at the front of the head. Down syndrome is another syndrome with hearing loss related effects. Now on to exogenous disorders. Exogenous disorders are hearing disorders that are caused by an outside source not related to genetics. These include ototoxic drugs, noise, inflammatory disease, or injury that causes damage to any functioning part of the auditory system. Exogenous disorders are classified in 4 different groups: conductive disorders, sensory neural disorders, retrocochlear disorders, and a central auditory impairment. A conductive disorder occurs at the outer and middle sections of the ear. Malformations of the outer ear can include microtia, which is the abnormal smallness of the ear, atresia, which is the absence of the opening of the ear canal, cerumen-osis, which is the excessive production of earwax, and neoplasms, which is abnormal tissue growth. All of these conductive disorders result in a mild to moderate hearing loss. Conductive disorders in the middle ear include tympanic membrane perforation, which is a hole in the eardrum, otitis media, which is a middle ear infection, very common in young children, otosclerosis, and ossicular disarticulation, which is the dislocation of the ossicles that usually occurs from trauma to the skull. A sensory neural disorder occurs at the inner ear and is caused by damage to the nerve endings or the tiny hair cells in the cochlea. Damage to the cochlea can be caused by viral and bacterial diseases such as meningitis or chickenpox. Also, ototoxic drugs that cause damaging side effects to the cochlea, noise-induced hearing loss, and presbycusis. Presbycusis is the decline of hearing as a person ages. It is caused by the degeneration of parts of the cochlea and beyond. Tumors, strokes, and systemic diseases like multiple sclerosis also cause sensory neural disorders. A retrocochlear disorder is caused by damage to the nerve fibers that go up the auditory pathways, past the cochlea, and into the cortex of the brain. Most often, a tumor is involved, such as an acoustic neuroma. This tumor forms on the 8th cranial nerve, which is the nerve involved in hearing. And the last of the exogenous disorders are the central auditory impairments, which involves damage to the nerve pathways within the auditory central nervous system.